The log roll technique. If you come upon the scene of a motor vehicle crash, you and other bystanders may need to help the injured people before medical care is available. A maneuver called a log roll is used to move an injured person safely if they may have a neck or spine injury. A person may have a neck or spine injury if they are unconscious and experienced high-risk trauma. For example, a motor vehicle crash, a long fall, or a blast injury. Or if they are conscious and have neck pain or difficulty feeling or moving their arms or legs. Use 4 people if possible. 1 at the head to hold the head and neck still, 2 people to roll the man, and the last person to slide the stretcher beneath him. The person at the head leads the team. He keeps the man's head and neck in line by placing a hand on each side of his neck collar and holding it in place. The 2 people rolling the man overlap their hands to hold his body securely. One holds the shoulder and the hip. The other holds the elbow and the knee. When the team is ready, the leader says, 1, 2, 3, roll. The people rolling the body work together so that the spine stays in line. The 4th person slides the stretcher under the edge of the man. With another command, 1, 2, 3, roll, the man is returned to his back. He may be slightly off-center, so in a coordinated movement, all of the people move the man together. The log roll can also be used to examine an injured patient's back. Cross the hands of the patient on his abdomen. The person near the torso places one hand on the shoulder and the other hand on the upper thigh. The person near the legs places a hand on the waist and the other hand near the ankle. The leader places his forearms tightly alongside their head with hands gripping the shoulders. He holds the cervical spine firmly in line with the rest of the spine. The leader signals 1, 2, 3. Then the team rolls the patient to his side. The back is examined, feeling each vertebra for signs of obvious injury or tenderness. Then the patient is rolled back on the count of 1, 2, 3. Remember, the log roll is a way to move an injured person safely to immobilize their neck and spine.